Was in the team, was in the presentation. Yeah, I tried to do that. Goes.
That's not it.
It was a great amount. Just put in.
Yeah.
The possibility, like that, I don't know for sure. I have. Yes.
Should get a send of 5 years.
Actually, there's 20 years. You just.
Why do you need to? That's when we sit down in classes. Oh, really?
We met this now.
Supposed to claim.
You know, there's a bit. All right, let me-
You click it on the bottom, right?
Not this doing it.
Good.
Sound good?
I think so.
Angela.
Angela. Sorry. Thank you.
Good morning, everyone. Sorry for the delays with the post-COVID world with our technology. Welcome, everyone, to our spring edition, March Commissioner Pharmacy meeting. Just some house rules for our studio audience or for those of us in TV land. Keep your cell phones muted, please. If you're online, please mute your computers until you're called upon. We will need to see you and hear you unless you're able to speak or appear before the board. So make sure your cameras and your voice works. With no further ado, attendance, starting with.
I'm Ann Taylor.
Kristen Linder, Mary Guanzi,
Angelo DeFazio, Commissioner.
Debbie Chisholm.
Gina Samples, Board Administrator.
I say March meeting, I meant the April meeting. I apologize. So, all right, let's get started. New pharmacy applications, Avon Infusion Center, 80 Fisher Drive. Is Avon Infusion Center here? Step into the gauntlet. Yeah, right there. Kelly. Or to tell the truth, the whole truth. So if you got. For the record, could you state your name and spell your last name? Is there any physician ownership in the pharmacy? National ownership, like restrictions of the state. Is there a point of sale system or a register? It's going to sit outside of the demised pharmacy. There any sterile compounding? And you attest to follow all local and state regulations. Have a seat. We'll be. So I didn't. You understand? What I mean? The flow here.
It's called Badger. Called Badger. There's a
How's the medication?
Oh,
This is patient specific. They're gonna be 7 minutes. So you're gonna have it done. Okay, good. So why don't you? You'll get there. Yale New Haven Health, Bridgeport Hospital, 267 Grand Street, Atlantic Street. Morning, Debbie. How are you today? Nice of you to appear. Please raise your right hand. It's very important. Nice to meet you. The record, you state your name, spell your last name. Position or help here. See that as the ability. Your point of sale system or register is going to sit outside of the licensed pharmacy area. And it will be in a sterile compound. And you would test the follow-on rules in the state. Yeah. You do it, Dan. For this week? Hospital.
Fine, I'm stuck. Stop taking stuff out. Call me.
That's the best. So, 11. Okay, he's back there just saying.
That's too many group.
Yes.
Did you know this?
Part of the phase. We'll just be a direct.
FEMA. Okay, pharmacy remodels, Nutmeg Pharmacy, 33 Kellywood Road. Mr. McKenna? Raise your right hand, sir. Try to tell the truth, the whole truth, and nothing but true self you got. The record, could you state your name and spell your last name?
Small C, capital K, FNA.
Is there, in your remodel, is there a point of sale system or a register that's going to sit outside of the pharmacy sterile compound? Test you will follow all local state building codes. Okay, so This is Ann Taylor, one of our new commissioners.
Pleasure to meet you.
How's the heart rate business? Interesting. An ace article. Oh, it's your own. It's not true now. Oh, it's true now.
Yeah. It would affect. Incredible. Just close those windows on that. Driving the truck lots of it. Yep. That's. Oh, man.
Actually, yeah. All right, wait.
Okay.
Tell me what's changing.
Things here.
And the business will continue to be operational. What has done your?
It's what we're speaking. Yeah.
It's too.
Thank you. Yeah, it's a pleasure. Thank you. Thank you. Thanks.
Thank you.
Thank you.
You're all set.
Pharmacy remodel, Walmart Pharmacy, number 10-5777. Providence Road, Brooklyn, Connecticut. Yeah, that's what I thought. You're here. You swear to tell the truth, the whole truth, and nothing but the truth. For the record, state your name, spell your last name.
Sure, Garrett Kavanaugh, CAVA.
Is there any point of sale system or computer outside the licensed pharmacy area. Or any sterile compounding is going to be. You would test to follow all local and state building. I see. Very interesting. Have you done this before? So is there a place that like?
That's when we.
So. So Amy, so there. She's new to the board, so. Basically, but there's. Yeah,
Thirty by.
It's very interesting how we did this. It's interesting, so and what's interesting about this is because they have so many stores that this works, it can kind of be a, they go build it, can use it and to still have to care, so it's interesting what they're doing.
We're gonna be doing that one. So I think you should better run things for it.
Anyway.
But.
I see what you're saying on the other side. They get. So now you're.
So we're.
That's
we're-
stupid.
So is. I'm changing the dimensions of the house. So basically, we're making this.
I said, just to be clear, what am I improving here?
So we
See, and, and so let's work on,
Looks like
a model first, and then we'll talk about. Right, we do. Okay,
Yeah. So.
Can Annie, you have a copy?
I have another copy of that.
Is this on yours? Is the remodel one on?
Remodels on this one.
Good, and so,
Yeah, then you have my.
but I want to make sure I can see the same things I can see.
What we're doing for you to see is, it's right now. That's the one.
Yeah.
Fucking worms.
Yeah. So what is this now? I've got to everybody else.
Check out station.
Check out the drama. So you have to know what we're doing is core.
City service. So. Really needs to be part of it, it's license wise. So then if it is, you. Don't all the gaps unless you. That allows you to keep saying.
It's a long.
And if in there, treatment fee. Greater in there because it's part of the business here.
This
Where people get in trouble, when this isn't part of the business here. The sharps and the show containers. Vaccines there.
Works all the time.
Is this going to be part of the business parts here? And but that means the store's got to be locked alarm.
Everything. And I mean.
Look very familiar. They had an issue with it.
She wanted us to. So.
Then it ended up.
Listen, this is. So what I've done is give you my record. Where it is, this well.
But that, no, I mean, remember, we're doing a separate.
Yeah.
Since
Thank
they.
you.
Everything's fixed. Yeah, we don't.
Oh, still good, brother.
Each. That I'll have to get.
Oh, right.
No, so I was lucky.
We have to get that approved first.
Yeah.
Ones from here. Same one that, what's the minutes, not the same one. You know, you're only going to there. To the.
This is here, it's just on the view. So that
No, that's fine, you know, but I don't know if it's like, let's talk, I see this amount of technician that. So it's just, so you know, that some things you're running this.
But then Renee, so she's going to start that good movement.
This is not.
Nothing, I mean, we're quite wise now. Because this is gonna be, these are, this is gonna be coming to a bitter near you.
Nothing to figure now. It has to come.
It's gonna be 25 yards. So basically.
There's a real student. Wire mesh. From the tops. Big kind of wire. They do that. HSLS. Put in the ground.
So I'm driving, there was a few store. So it's. So you got 3%. So car you driving.
So.
You're up
It's gonna be all for the stuff.
Sure.
But once that is all.
She has a Ford Rose, put it so like.
Customer service. This.
I. Oh, like, it was. And I was like, it's not. So I never spoke to them since.
I had. Create weakness now. I know. That's why I always say 20 minutes.
So safety.
Anything.
Same state.
It did for a while, but it's that, you know.
There's all three. It was. Let's figure this out. Yes.
They at least replaces those cells secondly, but it's not like we need this one. It's right. Sit in charged. This is the reason. Yeah, so it's just gonna be able to know.
This isn't.
I did.
I saw the same. So the, because there's not a bathroom, it must be like there. It's. It's your way.
I was remote. I
Technicians, what do they?
That's, yeah. Yes.
That's great. I like the new one.
So, yes.
Just either like.
That's exactly right. No, it's fine. There's no food, refrigerator. That's right. They serve.
Plastic surgery with just coming around, we're like,
This is really.
money.
Yeah, it's so very, the best.
And it's gonna be the same system.
So it's for our food. Oh, and that's not all. It's scary.
No.
We're not gonna keep you on.
We still, yeah. Okay.
So you're gonna basically do it now when it comes to clinical services, but in the movie. Side.
We go downstairs. So I don't know. But. I just think everything's gonna stay the same. Yes. Related.
Really?
Thank you.
Thank you. We'll keep you guys in the loop. Take care. I answered anything. I like it when you got me.
Right, in the matter of Avon Infusion Center, 86 Drive. Make a motion to accept the plans as presented. And also, caveat that they will follow all 797 regulations. Do I have a second? Second. All in favor, say aye. Aye. Opposed, abstentions, and please have it noted that Commissioner Linder has recused herself on that bill. New Haven Health Bridgeport Hospital, 267 Grant Street. I make a motion to approve as presented. Do I hear a second?
Second.
Favor say aye. Aye. Opposed, abstentions. Debbie Chisholm, pharmacy manager, commissioner, state. Pharmacy remodels, Milkmaid Pharmacy, 23 Killingham Road. Motion to accept as it was presented. Do I hear a second?
Second.
All in favor say aye. Aye. Opposed, abstention, so moved. Walmart Pharmacy, 10-5777, Providence Road, Brooklyn, Connecticut. Make a motion to accept as it was presented. Do I hear a second?
Second.
All in favor say aye. Aye. Opposed, abstentions, so moved. Pharmacy internship. Sai SL Akineni here or online?
She would be online.
Yes, I am.
Hi, how are you?
Good. How are you?
Good. Need to be able to see you. Where are you? There we go. Hi, how are you?
I'm great. Thank you.
Great. Could you raise your right hand, please?
Yes,
Do you swear to tell the truth, the whole truth, and nothing but the truth, so help you God?
I do.
For the record, could you state your name and spell your last name?
My name is Sai Akineni. Last name is Akkineni.
Very good, Sai. So for our interns, we like to call them in and see what type of experience they have. Make sure their hours, their preceptors. So why don't you tell us a little bit about yourself, where you're from, and what type of pharmacy you practiced?
Sure. Okay. I'm Sai. I'm from India. I did my PharmD in India. I practiced as a pharmacist in the same hospital that I studied at. Um, it's called Kasturba Medical College in Manipal. I practiced for about a year before I moved down here. I did my master's in pharmacotherapy from St. John's in Queens. And I recently cleared my FPGE last year, so I'm applying for an intern right now.
Excellent. And you already have a pharmacy identified and a preceptor?
Yes, I do. It's Lavin's Hancock Pharmacy in Stamford.
Yeah, I see here, Mr. Habib is going to be your preceptor. Tell us.
Yes.
So keep track of your hours. You know, you have to do 1,500 hours and keep track of those.
Mhm.
Just in case we department with our technical difficulties these days digitally, just to keep track of them, make sure you keep track of your 1,500 hours. And do you live in Connecticut now?
I just moved yesterday, so yes.
Any questions for Sai?
Yes, I
Welcome to
do.
beautiful Connecticut. Do you have any questions for us?
Yes. Will I be able to work for more than 40 hours? And if I do, will they be counted towards my 1,500 hours?
The answer is yes.
Okay,
Will you
great.
get paid time and a half? You're gonna get overtime?
I think so. I'm not sure.
I know. Well, welcome to Connecticut and thank you for appearing today. Good luck.
Thank you.
Thank you. All right, is IMH Ashur here online? Oh, hi, how are you? Thank you for being here live. Please raise your right hand. Raise your right hand. Swear to tell the truth, the whole truth, and nothing but the truth. So people. State your name as well. So you're lucky to go second because you get to hear everything that goes on. Very smart of you. Or whoever made the agenda. But very similar. Why don't you tell us a little bit about yourself, what type of pharmacy you practiced, where you're from?
So I just started pharmacist.
So I was thinking. It's an hour. Hours.
Type of pharmacy did you practice in?
So I practiced in these pharmacies. For 3 years, but then I believe it's very sure.
Just for curiosity, what's community pharmacy like in Egypt? It's like here in the States now, so. Very different, or
It's like the same.
is there insurance? I'm curious.
No, there's no insurance. It's a bit different. Similarities.
Is the pharmacist allowed to prescribe more? Like, the patient comes in and says, I don't.
Yes. The process is. Definitely like certain medication. The other medications this would be like the narcotics and those could be.
And you have a pharmacy
Yes.
receptor. So it's a you've got here. Any questions? We really appreciate you coming in today. Thank you very much and good luck. It's very good.
One last question, how I will give my farm and my license, it's gonna be like minimum.
As soon as you have your 1,500 hours, that young lady over there, it's a bunch of buttons.
You just be.
Miraculously.
Okay, thank you so much. Thank you so much.
Very good. Well, let's move on. CE waiver request. And Captain Kalenda, I see you there. You can unmute your computer now, sir.
Yes. How are you?
You raise your right hand. Raise your right hand, sir.
Yes.
You swear to tell the
great.
truth, the whole truth, and nothing but the truth, so help you God.
Yes, I do.
For the record, could you state your name and spell your last name?
Yeah, it's Richard Kalanda, Kolanda.
Kalenda, we have well, quite a bit of correspondence back and forth concerning your CEs.
Right.
Why don't you tell us a little bit about yourself, where you're stationed, appointment dates, and then what you're asking of the commission today.
Yeah, so originally I went to school at the University of Connecticut for pharmacy. That was back
Go
in
Huskies.
1984. I graduated in 1984, and then I moved to Florida and got licensed in Florida, and I wanted to still maintain a license in Connecticut and be able to work there. So I worked with Mr. Ed Liska about getting a reciprocal license. So I took the exam and got licensed in Connecticut. And that was, I believe, in 1987. And since that time, I've maintained my license. But in 2000, I graduated from dental school at the University of Maryland. And basically, all my efforts have been directed in dentistry and the practice of dentistry. I also went on to graduate school at Boston University, and I'm an endodontist. So I work in the Coast Guard, and I'm stationed in St. Petersburg, Florida.
So looks here, and Gina, just verify my information.
Right.
There's been no CE done the last 4 years, is that correct? Captain Kalanda? It is
Well,
valid, right? I don't want to.
I have done CE, but she's saying that the board does not accept my CE. So, yeah. So I'm working on completing the requirements that she said that I had to complete. So
that's quite a few number of credits. It's 60 credits,
right.
which 5 times 4, 20 have to be live. And
Yes, sir.
2 times 4, 8 of them have to qualify as law.
Okay.
Obviously, that's a lot of credits, and that doesn't include 2024's requirement. which would be another 15, same criteria, 5 live. Also, I mean, are you capable of completing all those retroactively, those CEs?
Yes, I am, sir. I am back pretty much from deployment, so I can devote my spare time to finishing them.
So, how long would be a very fair time frame for you to do that? I don't want to put too much pressure on you. If you completed,
I've
to the end of the
completed
year,
10
okay?
so far. I'm
You
sorry,
have
what?
completed 10 so far? You
Yes,
completed
sir.
10 so far?
Yes, sir.
You'll be able to complete all of them, including this year, by the end of 2024?
Well, yes.
75 credits?
Yes, sir. My goal is to finish them at least by the end of the summer. So the ones that I'm behind in from up to 2024 would hopefully be completed by the end of the summer, and then I will finish everything, like you said, by the end of 2024.
Why don't you give me a date that's comfortable for you that you feel you can complete retroactively? Years not including this year. Give me a date that.
Okay, I would say September. You mean the 60 plus the 15? Is that correct?
No, just the 60. The 15 is not due until January 1st.
So,
So just the 60 retroactive.
so I would say feasibly it would be at least by the end of September, so September 30th.
Why don't we say that October 1st, you feel comfortable that you're done by
Yes, sir.
October 1st? Just make sure they're ACP
Okay.
qualified. I apologize, Rich. I don't know if to call you Captain Kalinda, Dr. Captain
No,
Kalinda. I
no,
don't want to
it's
disrespect you.
fine. You can call
And-
you can
and
call
thank
me
you.
Rich.
Thank you for your service.
Thank
I
you.
appreciate it. Thank you very much for your service. There are, I know you must have CE for your dentist license, for your dentistry license, correct?
That's correct, and that's what I was trying to explain to Miss Samples that there are a lot of courses that I take that have an overlap with pharmacy. They're not going to show up as as a credit necessarily that you guys recognize, but a lot of the courses have like opioids and things mixed into them that I am taking. But I understand that you have certain requirements for they have to be recognized as an individual credit. So I will work on those. The other thing is that the other state that I have a pharmacy license in, they have an exemption for members of the military. So that's just something I was wondering if they do have that for the state of Connecticut or no. It's not
Richard, that's the
something.
first thing I looked up and we do not. And
Okay.
unfortunately, we do not. But I encourage you, if we approve this delay and you getting the credits in, there are ACPE credits that can kill two birds with one stone here, where it covers your dentistry and pharmacy. And I think you should try to seek those types of CEs out that cover both. Know that they're out there. Many of our ACPE will say this continuing education is good for physicians, nurses, and pharmacists. Some are just for pharmacists, some may be only for nurses. There are some that cover medical practice also, so I encourage you to look for those types of.
Okay. Yes, I will.
Anything else you'd like to ask of us, or?
No, that's fine. Everything that's reasonable. I should be able to get that done, and I'll just keep Miss Samples updated.
Excellent. Any questions from any of the commissioners?
No, I don't have
Yeah,
any
Commissioner
questions.
Taylor. Commissioner Taylor?
Can you tell me to?
Did you hear the question, Rich?
No,
Question
no,
is,
I'm
do you-
sorry. I did.
Yeah, the question is, do you plan on working as a pharmacist, as a licensed pharmacist?
Well, I like to keep my options open. I've had a varied career. I worked at the Food and Drug Administration. I've worked on ships like the Mercy ship and with pharmacy capacity. So I like to keep my options open. So yeah, it is a good possibility that I will eventually still practice pharmacy.
Any other questions for Captain Kalenda? Hearing none, I will make a motion to grant Captain Kalenda until October 1st, 2024, to make up 60 CE credits, including wide CE requirements, raw CE requirements. Do I hear a second? All in favor, say aye. Aye. Opposed? Thank you. Thank you for appearing before us today, here, sir. Good luck.
All right. Thank you for your time. Yep. Bye.
Okay. Oh, thank you. First time manager. Okay, this is where I test all my Italian, all my English, all my Natalie Brown. Natalie, are you here or in our
Yes, I am.
Zealand? Gina? Yeah, hold on one second, because I need to see you. We'll move on for that. Is Reza Dowdy, here? Reza?
Yes, I'm here.
Hi, Natalie, how are you? Okay,
Good,
I
how
need
are
to see you. There you go. Thank you. Where's Dresda?
Oh.
Is your
Let me
camera on?
It should be on right now. Can you see me?
Oh, coming in. There you are. Thank you.
Okay,
Very
yeah,
good.
hi.
Anita Lee. Hello? Anita Lee. I see your name. Anita, could you turn your camera and voice on, please? Go for a snack? Okay, we'll move on. I win. I see.
I'm online. Can you hear me?
Very good. Can hear you fine. Anita, are you here? Thanks. Yeah, could you push something to her?
Send her a chat.
So put
Gina.
the coffee down, get in the game or something. Anita? Is there any first-time managers here whose name I did not call? She's on the phone. She's on the phone? It's not gonna get it done. Your emails are very clear that they have to be. Is there any other first-time managers whose name I did not call? Okay. We're still one of the few states that actually, calling you in today, is watching you on the screen, but where you appear before the board. And we do that because pharmacy manager is a position of responsibility. And, you know, it's a leadership position within the pharmacy. And with today's work environment, whether you work in a big box or retail store, big chain or an independent, or even in a hospital setting, today's world work environment is very stressful. What we've discovered is the best and most efficient pharmacies, fewest problems, are the ones that have great leaders, that have outstanding pharmacy managers that can create an efficient culture within their environment. So we like to go over a few things that we unfortunately have seen at times here and just try to get you up on the right. I can't possibly go over all the requirements for a pharmacy manager in the state of Connecticut. I'll hit on some, but in the meantime, I suggest that you go on the DCP website. There's a great FAQs of pharmacy managers. They do a fantastic job of frequently asked questions and their answers. I think that'll help you dramatically. There's also at UConn, if you go to the UConn CE site, there's a pharmacy manager CE credits. Yes, it costs a little bit of money, but it's worth it because you get some credit too. It's called the Constant State of Readiness, which is a great title for pharmacy managers today. So I'm just gonna go over a couple of key things that we continually see and have issues with, so I want to bring them to your attention. A pharmacist manager has to work a minimum of how many hours per week? Someone has to. Pick on 35, minimum of 35. The reason why I bring this up, during COVID, there was closures, unannounced closures, and that 35 hours wasn't kept up here. Understand that if your pharmacy needs to close for whatever reason, you must notify the pharmacy, must notify drug control, let them know these hour changes, and you must post it because patients need to get their prescriptions if they show up at the door. So we need to know. So be aware, very aware. We've had a lot of closings for many different reasons, as I just stated. Stay on top of it. If you know there's going to be a closing, if the store's not going to be able to have a pharmacist there, please report it to the commission. Don't depend on someone else doing it. Please don't depend on it. Expiration dates of pharmacy technicians, pharmacy licenses. Make sure that we simply kept the calendar in our stores where we said, okay, this pharmacy license obviously expires on this particular day. This technician's expired. Make sure you text licenses are kept up to date. Your pharmacist licenses are kept up to date. All your staff pharmacists. I often tell the story of a staff pharmacist that didn't renew their license, but they continued to practice. And it was a misfill. And when the attorneys found out that they were licensed, because they never renewed their license, they clawed back every prescription that pharmacist ever filled. All the insurance companies took over. So stay on top of your licenses. Continuing education, as you heard a case before it. Not sure why, but it's become an issue. Answer yes, certifying that you've done your CE. Please make sure that you have fulfilled your CE. Some of the issues were now we're on your license, so hopefully some of that CE issues go away. 15 CE credits every year, 5 live, 2 must be law. It's required for licensure in our state. Diversion. We don't like to talk about it, but it's something we need to talk about. In our state, specific pharmacy managers and staff pharmacists will have direct supervision over their technicians. Know what's going on in your pharmacy. Understand you need that day lock on your vault. Know that if you have a robot and you have scheduled medications in that robot, then robots seem to over and under at times. Don't ignore the robot screaming, I don't think my count is correct. We had an instance where thousands of tablets, the robot dispensed, and can't talk to a robot. Find out whether or not it was really over dispensed. So make sure your platters are set correctly. If you have any counting machines that are calibrated correctly, stay on top of that. If there is anything that's missing, how long do you have to report it? 72 hours, even if it's one tablet. Within that 72 hours before reporting it, you may find it was a partial, you may find it was a miscount in the inventory, but if there's something missing, you must report it within 72 hours. It's really important to do that. And the reason for that is if an agent comes in and they have to recreate all those films, you don't report it for 6 months, all those prescriptions that have been filled, it becomes very difficult to go back and find where that mistake or diversion took place. So make sure you report it within 72 hours. Tech ratios. What are the tech ratios? A lot of
One
answers.
pharmacist.
2 to 1, 3 to 1 if you're nationally certified, 4 to 1 between the months of October 1st through March if they're certified in immunization. So you can have a 4 to 1 tech ratio during that period to help alleviate some of the immunization clinical services that are doing. PMP, make sure you stay on top of your PMP. Don't ignore PMP messages. Don't ignore PMP process, especially in today's digital world. Tremendous tracking that goes on in PMP. So stay on top. Misfills. You know, it's something that we don't like to talk about, but it does happen. We're human. It does happen. Do not sweep it under the rug. A lot of problem with insurance. Make sure you contact the physicians, the patients, everyone involved. Make sure you come up with a plan on how it's not gonna happen again and keep that on. Because the worst thing that can happen is that somebody comes in months later and now you have to do it by memory. You don't have it written, quality assurance. So don't sweep Misfield. One of the things we did at our stores, and it really worked out great. Tell the story, but I apologize for those that have heard it before. We actually kept track of near misses where pharmacists did pick up something. Technician picked up something that the pharmacist did. So we kept track of near misses. One of our techs seemed to have a lot of near misses. And we ended up discovering that that technician was dyslexic. So naturally, the technician no longer prescriptions. We put into the word something where the dyslexia could for public safety. So maybe a good, a wise idea to keep track of near misses so that helps with this bill's done. I can't believe I have to say this, but it's happened. If a drug control agent comes in, first of all, you should always ask someone for their badge or their license that they have. Don't let anybody into the pharmacy. Right? You can ask them, it could be a repairman, make sure they really are a repairman. And when a drug control agent shows up, it's no means asking for their credentials. But they are allowed in the pharmacy. You can't say, no, I have to call my boss, you can't come in. Well, why don't you come back another day? And so if a drug control agent appears before you, they are allowed into the pharmacy. That, I'm going to turn this over to Commissioner Iguante to talk to you a little bit about the MedWatch program. Commissioner Iguante.
Thank you, Chairman. Thank you all for appearing today before us. As you heard, trying to review some very important information to be successful in your new role. With that, we'd like to also mention the FDA MedWatch program, which is a service you can, for free, you can just sign up to get these push emails. So you will immediately hear about any potential recalls, concerns. Obviously, right now, there's a lot on that website about Chinese manufactured syringes. And the FDA has made a formal guidance on certain syringe sizes. So again, the whole intention here is just to help you be successful. It looks like most people are very large chains, so they will have their own methodology for keeping you up to date. But again, your responsibility with your license, you're a lifelong learner, and that is part of what you have to do to keep yourself, being at the top of your license for your patients. So again, just something to file away in your toolbox and sign up with my email. And I hope you have great success in your leadership role.
Just a couple more things before some of you look like you're not where you go out your day. Couple of things. There wasn't any legal cases today, and I made sure that pharmacy managers, first-time pharmacy managers, always appear after our cases. But typically, when you hear our cases, it really comes down to judgment. Make good, sound judgment. There's black and there's white, but if something's gray, and in our world, there's a lot of gray that may happen when you're behind the counter. Use good judgment, and we're here to help. We're not, if there's a question, you can call one of us, you can call drug control. Don't guess. Guessing may not always be the right answer. So do no harm, use good judgment. I want you also to remember that company policy may not be state policy. An owner at an independent may ask you to do something. Big box store may ask you to do something that may be not in line with state policy. Understand that it comes before us, state policy will supersede. You're the boss back there. You run the show back there. So you're responsible for the techs, you're responsible for your staff pharmacist, you're responsible for that licensed area. So treat it that way, leaders that you're working. And the last thing I'll leave you with is I encourage you to join your associations. Join the Connecticut Pharmacists Association, join APO, join NCP, join if you have specialty, oncology, join the Association for Pharmacists and represents that. The wealth of information that I've learned from the associations I belong to invaluable. So with that, any questions for us? The smiles? Good luck. Thank you, and I hope we only see each other at social events, not here. Take care. Thank you. Okay.
Thank you.
Moving on. Moving on, reciprocity interviews. Commissioner Linder.
So we had a total of 11 candidates for reciprocity this month. And much, Tina for doing. All that. I will become. All out.
There's a motion before us. Wait, you're a second. All in favor, say aye. Aye. Opposed, abstentions, so moved. Thank you, Commissioner. Moving on to request for non-resident pharmacy approval. Very simple process in our state. Commissioner Watson.
Thank you, Chairman. You all received as part of your information packet, my report for the non-resident pharmacy applications for this time. While we did not have as many, I was really only able to approve 2 of them. The rest have been rejected due to incomplete submission of data. And that is all documented in the report. Additionally, on the agenda, what we are doing is previous applications that have been rejected for insufficient data, we are now bringing back to be reviewed. So I want to just walk you through that. The next section on your agenda is the request for non-resident pharmacy approval. And there are 2, the JKR Pharmacy and Little Neck RX Corporation. Both of those were previously denied. JKR had some citations, and I requested to see their connection before we could and submitted that. And the Little Neck Pharmacy, again, they did not provide us with all the data that was required in the application that they have a sense. So those 2 are now in good shape. And then the next section, these 2 pharmacies have requested to add sterile compounding services. The first one, Prosperity Pharmacy, I'm going to recommend we do not vote on because I have not received all of that information yet. FNF Holding, we have received everything from them, and their application is in order. The final one is an in-state pharmacy, Genoa Healthcare in Hartford, and they are requesting to add additional services, and that was part of the packet Gina sent out to everyone for this meeting. And that concludes my report.
So is Genoa here? Okay, great. So we'll call you up just to describe what you'll be doing. We won't vote on that until. Perfect. Okay, great. Okay, hearing Commissioner Inguante's report, I'll accept the motion. Resident pharmacy approvals. Here a second. Second, all in favor, say aye. Aye. Opposed, abstentions. That's I like that we follow up. Yes, there's denials, so that's, I know.
We just didn't report it out. There's always lots of.
That's fantastic. Genoa Health here. Come on. Swear to tell the truth, the whole truth, and nothing but the truth, so help you God. I think state your names. That's not.
This is how the rep sent it
It's
today.
different, okay. So it's, how do you spell it? What's your last name?
Burkhart, B-N-Y, U-R-K.
Thanks, that's not. I appreciate it. So what brings you in today?
Just looking to add, right now, we're, just have the long-term care license. Now, the reason behind that will, it's just we've had some trouble, getting, an insurance rejection approved. There's just one insurance company that we're just having trouble with when we want to do, renewal too soon. We're not recognized as that community practice. So that's really
So your nomenclature in our state license is pharmacy to one encompassing license. Services have changed, so you're going to get that too. My question is, and there's an opportunity also, is there any change in design to accommodate long-term care design and pharmacy design? Very different things, so they're going to be changing.
If not, we already have accessible to the public windows. We should have been able to service the public.
Description labeling, all that. It's going to be the same, it's going to be patient specific, everything like normal. Yes. Sure, what?
Will you believe, or are you currently providing non-sterile compounding? And so in your Unity licensure world, you don't intend on providing.
Any other questions? Mr. Carey.
I would say I have a suggestion. It's at a minimum. No, service has to be licensed. After we. Should be original. So community practice, in addition, are you going, they're not sterile. I feel bad that you have to. When you put it. To be your license.
Yeah, but think of the opposite. What if she was community pharmacy and had sterile too?
Correct.
So anytime a service, anytime the nomenclature of the pharmacy changes, they have to appear. In this case, it's very benign. The license certainly covers community pharmacy, but it is a change in your scope. Whether it's for insurance purposes or to accommodate patient access or care, that's not up to us, that's up to you. But you did your due diligence, but.
That's what I'm thinking. Community should be a default. I thought, is at the minimum, everyone has to meet.
But they didn't pick that. They didn't choose that. They don't like those, I don't care.
Right, and that,
So, right. But I'm sure that Julie is going to bring this back to Jennifer, who appears before us quite often, and say that from now on, with community services with our long-term specialty. Or whatnot. Heard what's before the commission. Do I have a motion to accept the services being added to the general healthcare? Your second. All in favor, say aye. Aye. Opposed, abstentions. Thank you, Julia. Thanks for coming. Appreciate it. Miscellaneous. We have a few miscellaneous. As for the record on the agenda, it's not the NABP annual meeting update, it's the NPJE AP update. Commissioner Linder, what can you tell us about?
Well, this year I participated remotely. So what this will be about is reviewing item development training materials this year. It was not done live, but they provided materials. And also writing questions for the Connecticut and PGA. Based off of the various. They will look at a breakdown of how many questions they had, and competency, and which competencies were in. So all of the item writing actually took place. That last year, so I was told. The next step will be in August and September. We will select new questions based off of the way, essentially all new questions from all states, something from our state laws, and then
questions for commission? Just one quick question, like on laws that changed that went into effect January 1st in our state. Those want to appear on this exhibit. So there is a lag time.
There is one.
Just
Right, sorry.
Sounds great. Thank you very much, Commissioner Linder. Pharmacist applications / new graduates. Gina. Yeah, for us.
Okay, so for this is mostly for our new graduates that are online. They are attending online as we are not, they do this goal through their classroom setting. So this is just some housekeeping rules. We just wanted to let you know, like there'll be a flood. You're all new graduates and we will be getting your applications. So we did want you to know the best way to apply will to be through the online portal. If you go to the website and you put in Connecticut DCP pharmacist, it will bring you right to our webpage. Just be sure to look at everything that is on the webpage and what is required. Your 1,500 hours, there's a school verification form. Please make sure that information is complete so that we can process your application as soon as possible. And the reason for saying this, we do have 7 to 10 days to process your applications. So we are from the date that we receive them. So the more phone calls and emails that we receive does asking for the status of the application does slow us down. So we are we will be getting to them. We've processed them as quickly as possible. And on the pharmacist page, there is an email address. If you really need to ask us, we do have a pharmacy team and we will answer your questions as quickly as possible. And of course, I know none of you can see me. So I apologize for that. Our virtual is not in working order today, but my information is on the Commission on Pharmacy page for contact me.
Any questions in PD land or board administrator? Rita, example? First. Thank you, Gina. It's always an onslaught that time of year.
Sorry.
It's always an onslaught. Your pharmacy, your pharmacist here. Okay, thank you for that update. I actually put this on the agenda today, and I think this morning was evidence of put it on the agenda. This is just for us commissioners to talk about and whether or not we're going to continue this hybrid issues that we've had technology wise. I think that some of the suggestions I have is that all first-time managers in our state should appear at the size of Texas or Florida. No reason why they can't appear like they did for decades. So I'd like all first-time managers to have to appear at the board versus hybrid online. I think anyone that's going to speak, unless they're out of state, Captain Kalanda was today. They have to appear hybrid. I think if one of the commissioners can't make the meeting, because they're at a conference or things come up, commissioners should be able to attend because we have strict quorum for our commission. So commissioners should be allowed to hybrid. It's the case. Obviously, there always should be live. I'd like the board just to have an open discussion on if we continue as is, to the changes, and if we do make those changes, when does that take? Commissioners, suggestions or?
I agree. My only ask would be if there's an exception, because there's always an exception, that exception is brought to Gina and the commissioners review it and determine whether or not that's a reasonable exception. I don't want someone to have to make a decision. Maybe they have a so just want to make sure that it's not like a black and white, but I strongly encourage everyone to attend if they can.
And to put this into effect, we're going to give fair dates so that
I was gonna say, yeah. Well,
in June's meeting, the last hybrid
Yeah.
meeting, except for some of the exceptions we talked about. Yeah, is there a way to publicize that immediately? That if you're gonna speak Or if you're a first-time manager.
Yes,
We can have it here, unless you're out of state. If you do have a certain circumstance, you can always ask you for a waiver. Let us know, email all of us. Just yes or no, more than likely, say yes. There's a lot of one. I think that'll, I think a lot of stress off of what happened. I know they love to hear me talk. 15 minutes, their lives was ruined.
So just to be clear, August would be our first mandatory in-person meeting.
I think I should take a motion for that. I make a motion to change the hybrid status as discussed, first-time managers, anyone that speaking will have to speak live unless they live out of state. There will be exceptions for waivers if needed to be implemented as of August's meeting. A motion, do I hear a second? All in favor, say aye. Aye. Opposed, abstentions, so moved. Very good. And hopefully everyone had a chance to look at the March commission meetings. If there are any additions, changes, or errors that anybody would like to report? Hearing none, I'll accept the motion to accept the March meeting minutes. I hear a second. Favor say aye.
Aye.
Opposed, abstentions. Shall make a motion for adjournment. Do I hear a second? Favor say aye. Aye. Opposed. Thank you, everyone. Thank you very much.
Sure, we'll see each other.